Hi, I'm Dr. Rajani. Thanks for joining me today. Does this RF microneedling get rid of fat? I had one yesterday and I'm going to share with you what it was like, my results, what it looks like after one day, and also compare it to the VFR. I did a video called No Filler, No Botox, No Problem, and that was the Viora VFR. There's no needles in that device. It's proprietary technology, and a lot of people were confused, so I want to clear that up. That's going to work from the superficial to the deeper layers. Nothing enters the skin, so there's no real pain, but just incredible results. What I did yesterday involves these needles. So you can see there's actually needles that go in. It hurts, there's pain. You have to, for me, the settings I'm going to use topical lidocaine, and I'm going to inject with lidocaine. And if you know me, I rarely use any numbing for my patients or my own treatments. But with RF microneedling, it goes in and heats. Now, where am I doing? Because everyone's worried about fat loss. So where am I doing it? Where I want to get rid of fat. That's where I do RF microneedling. What I use are insulated needles. So I can see why everyone's confused about it, but these are insulated needles. So the needle goes in and it heats up deeper. And I go in for a long pulse duration and high heat to medium heat. There's good evidence that you don't need the highest level of heat, but that the pulse duration makes the biggest difference. So that's what I'm doing. These are the needles. Where would I do it? Where do I want to get rid of fat? I'm one day out, right here. And you can see some redness through here, and look here. You see a waddle more than usual. And you see redness, and you can see that's where I treated. This is where I treated. And then I lightly treated here because I want to get rid of a little lower base fat here and also tighten the skin. But the settings here were much different than here. I hammered this area. Deep heating. So what's that mean? 3.5 millimeters deep at 1 second. Now, if you're using something like a Profound, you can get to 3 seconds. I used a Lutronic Infinity, very tunable. There's an upgrade to that, but I like old school because I know my settings. I know what I want and I can tune it. I don't need feedback from the machine to tell me. I can use my knowledge. So you see, I'm gonna treat here, I'm gonna tighten, I'm gonna have swelling. This is 1 day out. So this is what it's gonna look like at 1 day. I'm at work, I do everything. I didn't get much bruising at all. I feel comfortable. Do I notice it? Of course you notice it. Right where you don't want to have swelling, I have swelling. But if I'm standing back here, most people aren't going to notice it. So, and they know I do treatments. Now, there was a silly question asked from the Viora VFR that I wanted to address. And what it was someone said, Rajani, if it works so well, why are you getting injections? I don't get a lot of injections. You know I like plasma sculpt, but here's the thing. They're not mutually exclusive. You do it all. So I'm going to reduce fat here, great. I'm going to use RF microneedling. I'm going to use Viora VFR for the surface of the skin and deep collagen production. And if you want contour, then you're going to use fillers. If you want collagen stimulation by biostimulators, then I'm going to use plasma sculpt and PRF under the eye, because we don't want to use fillers there, and I don't ever use Sculptra under the eye. So these are all tools. So yes, RF microneedling can be tuned to get rid of fat. It can be tuned to tighten the skin. You can use the Viora VFR differently, then fillers, then collagen stimulators. It's about using combinations to the extent that they should be used, but multiple ones for different things. So I thought it was a bit of a crazy question. If this works so well, why would you do this? You do it all and you have a plan, a treatment plan. And I think that's why there's a lot of questions within the channel and a lot of confusion. Why not do a chemical peel? Why wouldn't I do a chemical peel? That's not gonna get rid of this. That's not gonna get rid of this, but it's gonna help skin glow. It's going to help brown spots. It's going to help different things. So yes, now I will do a chemical peel. How long will this swelling last? Probably about a week. When will it start looking good? 2 to 4 to 8 weeks to 3 months. And you can watch in the videos. This is the third treatment of RF microneedling. So you can watch, and you just watch a video from 4 years ago and then watch one recently, and you can see and feel free to ask what's done. So RF microneedling, deep heating, insulated needles. You can target fat. You cannot target the epidermis, the stratum corneum, the surface of the skin. And then fillers, Botox, collagen stimulators, it all works with it. This gives you an idea of the downtime. Because they're insulated, it's not going to affect the dermis, but it's a little sore and a little swollen. Yes, you want to get rid of fat. If you don't want to, the settings are different, and that's why home devices are variable. And when you ask, should you get this, or this device, a lot of it depends on your provider and the settings. You have to start with a great device, but the knowledge up here of your injector is absolutely key to make that device run. Stay tuned here. I put a complete playlist up here, things you can do at home to keep your skin and body beautiful, healthy, and vibrant.